at Emory with her second transplant. She had had it at another center and had come to us with pain over her transplant site. And I'd actually been involved where we had to remove that kidney. She'd already started dialysis, but that remaining kidney was just so painful. And not all kidneys get removed, most of them stay in. But we had to remove that kidney, and that was the first time I had met her. The first thing to do with Emory was every donor that she had, she was like cross-match incompatible, tissue incompatible. Because of prior transplant, she'd been so exposed and had so many antibodies that we had to then say, we got to find her somebody that she's tissue compatible or histocompatible or cross-match compatible. And if we find her that, then we see what the ABO looks like. So we were very lucky that we found her as best a match as you can for somebody who's not directly related to you in the database. And then that person's recipient was able to give to, that person's donor was able to give to another recipient whose donor got freed up to give to the primary recipient. So that's how the three-way swap worked out. But it started with finding a compatible match first for Anne-Marie on the HLA end. Now, when we found that HLA cross-match negative donor for her, that donor became a different blood type from Anne-Marie's. So then we had to find the antibodies that Anne-Marie would naturally have in her blood to that donor's cells. And then we had to quantify how much she had to see if it's something we could easily reduce. And luckily we were able to quantify it and show that it was in a level that if with the interventions we have come up with, we'll be able to reduce her pretty effectively. And so once that was a go, the other pairs were all compatible. So they were in an incompatible situation before, but because of the swap, they all became compatible. And so once we decided the surgery date, we worked our way back from it and said, these are the number of treatments, this is the medication that she needs to start, this is how long she'll need to start, this is how we're going to monitor her. And we wanted to get to a point where she would be, where the titers that we were looking for were in the range she needed to be, showing that the antibodies was as low as you're going to get before we could go ahead and proceed with transplant. So we were able to do that for her, and that was a green light to go ahead and get all the patients transplanted. So it meant sending 3 donors off that morning to surgery, followed by the 3 recipients, and the kidneys going to the right place, orchestrating that, and then slowly the recipients coming out of the operating room.